Here's the sound of a cancer cell. Here's the sound of a healthy cell. It's a technological breakthrough. That's what it is. That's what the scientists are saying. CytoAcoustics is based on a technology for measuring the acoustic vibrations and movements of cells. These cells are communicating, and we figured out how to measure it.
It is a technological breakthrough when you think about you're showing somebody something that they've never seen before.
I am interested in the possibility that living cells communicate with each other energetically. Everything living moves, and anything moving regularly in a medium is generating acoustic signals. The possibility of understanding those gives us a whole new perspective on cell function.
It's a tool. It's an amazing tool. It's a tool that's looking at it in a totally different way. The new aha moment that gets us thinking in a new direction.
You know, you might have heard of Michael Lewis in the book, The New Thing. And in it, he has a quote. The new thing is when you see or experience something and you say the whole world just changed. That was my first impression of when I saw CytoAcoustics. Oh my, the world will change.
My brother got sick, and he had cancer. I went to one of these scientists, these world-leading scientists, and asked him a bunch of questions about was there another way to help my brother. He told me that genes are being turned on and off by vibration. And I was like, what? He said, yeah, we think it's mechanical, not chemical. I was like, what? Well, let's measure it. I make machines. That's what we do. So it was not that unusual to make a highly sophisticated new kind of microphone, really.
It strikes a really sharp chord with everybody when you start to talk about cancer. I lost my mother to cancer just 2 years ago. If I knew that there was a way for us to understand the type of cancer she had and the state of the cancer, and that there was a potential non-invasive treatment to solve it, that's world-changing.
You know, when we started this project, I had no idea whether we could actually measure something that was that quiet. Cells vibrating. I thought the idea was kind of far-fetched.
My introduction to Paul Reed Smith and digital harmonics, I went in to just sit and chat and find out what they were up to, and realized that they had created a new segment of signal processing. This idea of talking to cells. There are two issues. One is they're well deep into the noise floor. You have to very carefully figure out how to pull them out of the noise. And at one point it dawned on me that they realized the noise was the signal.
So that led to years of development of experiments. Here we were in the DH offices looking at the output of the PMM, looking at a signal, and we think we have something.
And one day we thought we got a signal. So we took formaldehyde and we put it in the Petri dish. And over a 10-minute period, the signal slowly went away. We went, oh my God, we got a signal.
And it was like eureka. We were like, we're onto something. We got something here.
We had to rebuild the machine again. We had to rebuild the machine again. We had to do all this stuff. But the miracle of it is that it's measurable.
We classically are only interested in signals that are useful to the five senses. And here was a signal that had nothing to do with the five senses. Pulling something out of the noise is not an easy thing to do, but that's what he did.
We built the matrix. We knew it was special, but we didn't know why, and we finally found a gorgeous use for it.
It truly is a breakthrough technology. It completely changes the potential future of healthcare delivery.
These signals could be analyzed by computers. That would give us another way of understanding whether they're normal or abnormal.
When you look at the output of the precision measuring matrix, you're seeing the cells over time move by. And what we've done is we've taken what's normally looked at in a two-dimensional plane and we've made it three-dimensional. So now I'm able to look at time coming by. I can look front to back is my frequency. The z-axis is amplitude. So those are the things going up and down. It's the amplitude modulation of that frequency.
Being more of an engineer than anything else, I was happy to see the spectrographs and look at them and see where the information was and see that it was in different places. It's like speaking a language. When you look at these things, if you learn the language, yeah, you'll be able to understand them. And so I think there's this learning process of how do I begin to learn the language of the cells?
Becoming skilled at interpreting these energetic signals, we can identify much earlier stages of disease than we can by conventional pathology. It certainly makes sense to me that the earlier you detect disease, the easier it is to change it.
The most important resource we have is time. CytoAcoustics can give people a precious resource, time. The ability to do clinical trials faster, the ability to get better decision-making in clinical trials. Is this the right patient for this drug? And ultimately, and most importantly, giving the patient the right drug at the right time.
So as we've been doing measurements, we started to introduce different adjutants into the cells to see what the reactions were.
If there are 7 drugs to go after this cancer and you put each of those 7 drugs in the same petri dishes, their reactions are completely different within minutes.
If we can start to figure out how to determine which drug is going to be most effective for that specific individual, almost precision medicine, that's pretty incredible.
One of the biggest barriers today is the amount of time it takes to understand whether a drug is working. With CytoAcoustics, I can have greater confidence in putting a patient on a medication that's going to work for them, not 1 month or 2 months later, the next day.
There's a lot of research to be done. There's a huge amount of research to be done. These scientists believe we've found a new domain, a new way in to this monstrous problem we call cancer, and I think there's going to be ramifications way beyond that.
How can this be used in solving any problem? What are the other areas that we can explore that have the same characteristic, same frequency bandwidth and the same amplitude, that we can do new things that we've never done before?
Here's the list of the applications that some of the scientists thought it would apply to. I mean, as we scroll down, it's just mind-boggling.
Every single one of them is game-changing and groundbreaking.
Digital Harmonic has 29 patents, and a good portion of them are on the precision measuring matrix.
With the patent, the way it was designed, the way it was written, and the way it's been issued has given us a lot of room for follow-on patents. So there's a pretty significant body of work that we can generate that is patentable on the heels of this.
I'm very excited about CytoAcoustics. I see it as a big step in the development of the whole field of energy medicine, that is of understanding the body on an energetic level, not just on a structural level. And I think that opens up many more possibilities for understanding how the body works and how we can change its function.
What excites me is the unknown. That is one of the intriguing things here, is we've kind of taken a different view of the whole world of medicine. Amazing possibilities.
Why am I so excited about CytoAcoustics? This is something that will allow us to expedite the treatment of patients. It will allow us to have a more precise, targeted way to treating patients with cancer, and actually without cancer.
It's not often you get this chance to do good in the world and do well in the world. This technology pointed at cancer measurement, cancer diagnostics, cancer therapeutics.
It looked pretty nuts in the beginning. It's not nuts now. We have a patent on it. And this is a seminal patent. There's going to be piles of patents afterwards. My goal is that if they're teaching CytoAcoustics in the medical schools, when I die, I'll have done my job.